I want to tell you a story about how a skinny Haitian chicken and a bowl of beaten cabbage soup turned my world upside down and helped me think differently about how we can deal with this crazy epidemic of lifestyle-driven diseases like heart disease, diabetes, obesity, what I like to call diabesity. How can we even think about solving a problem that will cost the global economy $47 trillion over the next 20 years, and by the end of this decade will kill 50 million people, killing twice as many as infectious disease? How do we even think about a world where now there are more people who are overweight than are starving? How do we think about a world where there will soon be 500 million diabetics and almost 1 billion pre-diabetics, and only a fraction of the doctors and healthcare workers we need to take care of them? These aren't just diseases of affluence. They're exploding in the poorest countries on earth. So what does a skinny Haitian chicken have to do with rethinking how we approach chronic lifestyle-driven diseases? Well, my rethinking started on January 1st, 2010, the first day of the first month of the first year of this new decade. And I just finished a book about Paul Farmer, who had successfully tackled the worst diseases in the worst places on the planet. Paul Farmer successfully treated TB and AIDS, which everyone thought was untreatable, in the face of extreme poverty in places like Haiti or Lima or Rwanda. Paul realized we didn't need a new advance in science or a new medication, but something very simple: to rebuild community and connection in broken communities. Paul's genius was his insight that the key to solving insoluble healthcare problems was each other, was people helping people, or peer support. Paul's genius was the idea of accompaniment, accompanying each other to health, helping each other build back their communities with clean water and food, and going to each other's houses, to their sick neighbor's house, and help them know when and how to take their medication. Now, it wasn't just a better delivery model for the right drug or the right information. The community was part of the cure. The community was the medicine. So that's how I spent the first day of January on this new decade, an auspicious day, thinking about how Paul's insight about infectious disease might help us solve other chronic disease epidemics like diabetes and heart disease. And as this idea was shaking up my world, a disaster happened. On January 12, 2010, a few days after that time on reading his book, that massive earthquake hit Haiti. 2 days after that, I arrived with my wife at sunset with Paul Farmer, who I'd just called out of the blue because I knew he would know where to go, and I asked him to come with us on a small plane with our small medical team. We arrived into the chaos and devastation and overwhelming suffering that was Haiti that day. And we unloaded our plane and we went directly to the main public hospital in Port-au-Prince. After a week of 20-hour days, amidst amputated limbs and amputated lives, I finally got to eat a meal. And I sat down and I had this meal of some rice and some skinny Haitian chicken with the director of the hospital, Dr. Alex Aseg. And as we had our first meal in days, I tried to find some meat on that skinny chicken. I asked Dr. Aseg, what was the most common admitting diagnosis here in the hospital before the earthquake, this main public hospital that served 8 million people in Haiti? And I thought he was going to say tuberculosis or AIDS or malaria or TB. But here in the poorest country in the Western Hemisphere, in one of the poorest countries in the world, it wasn't TB or AIDS, but diabetes, heart disease, and high blood pressure, 90% of which is preventable and often reversible through lifestyle. These chronic diseases have reached every corner of the globe. They touch everyone on the planet. It's you or someone you know, someone you love. Most of these conditions, like heart disease and high blood pressure, many cancers, stroke, even dementia, are caused by the same root problem. It's what I call diabesity. It's that continuum from a little bit of belly fat to pre-diabetes all the way to full-blown type 2 diabetes. So I'm thinking to myself, sitting there in this crumbling hospital building in Haiti, where diabetes was the main admitting diagnosis, how do we deal with this crazy, overwhelming problem of obesity-driven disease that's getting worse and worse, costing more and more, despite our best efforts to treat it with medication or surgery? How do we deal with the fact that diabetes will soon affect 1 in 2 Americans? That now affects 1 out of every 10 Americans with type 2 diabetes, and 1 in 5 African Americans, and 1 in 4 Medicare patients. And that 1 in 3 Medicare dollars is spent on type 2 diabetes. And my God, that 1 in 3 children born today will have type 2 diabetes in their lifetime. And that 80% of the world's diabetics are in poor countries. And that half of all diabetics there are undiagnosed, and probably all of the pre-diabetics are not diagnosed. So it was in the aftermath of being up to my elbows in blood and pus and broken bones and broken lives and broken hearts that I first understood what I had completely ignored and neglected over the last 15 years of diving deep into systems biology and genomics. I was so hyper-focused on biological networks and systems medicine and network medicine as the answer to solving the puzzle of chronic disease, on turning the dials on biology for individuals, that I missed something much more important. That most chronic disease is very often a social disease, not just a problem of biology. We know that you're more likely to be overweight if your friend's friend is overweight than if your parents are overweight. That the genetic threads that connect us may be less important than the social threads. That our social connections and our ancient need to be part of a tribe may be our way out of this epidemic of chronic disease. That just maybe sociogenomics, or how social networks influence disease and how social networks alter gene expression, is where we need to look for the solution. In some places, gastric bypass is being touted as a cure for diabetes, as if you could cut out a poor lifestyle like a wart. Is this really a solution for a planet of 400 million diabetics at a cost of $30,000 per person? That's $12 trillion. We can't medicate our way out of a bad diet. I mean, taking a statin while downing a double cheeseburger, soda, and fries just doesn't make any sense. But there has been one new drug discovered, and this new drug can beneficially modulate thousands of genes. It can enhance the function of dozens of hormones. It can regulate tens of thousands of protein networks and can even prevent, cure, and reverse most chronic disease. And it works faster and better and cheaper than any other drug, has no side effects, and it's available to almost everyone on the planet right now. It's food. We now know that food is not just in calories, that it's information, that it can upgrade your biological software, that the majority of chronic disease is primarily a food-borne illness, that we ate ourselves into this problem, we got to eat ourselves out of it. Look, high cholesterol is not a statin deficiency. Diabetes is not an Avandia deficiency. It's not doing the same things better. What we're really doing isn't working. It's like rearranging the desk chairs on the Titanic. Look, statins increase the risk of diabetes by 48% in women. And the number one drug for diabetes, Avandia, has killed nearly 200,000 people from heart attacks since it was introduced. So let me see. Statins, designed to prevent heart disease, cause diabetes, and the drugs designed to treat diabetes cause heart attacks. That's what I call Pharmageddon. Now, after Haiti, I realized that the answer had to be somewhere else. If social networks can promote unhealthy lifestyles, maybe, just maybe, we can use social networks to create health. Look, we know how to treat and prevent and even reverse diabetes and heart disease. So why don't we do it? Why have we failed so miserably at this? We can eradicate type 2 diabetes, just like we eradicated smallpox. We may not be able to win the war in Afghanistan, but this is one war we can win. And people give up. They give up when trying to think about how do we deal with this obesity and chronic disease epidemic that's killing most of the people on the planet. It's too overwhelming. it's too big. But I don't think it is. I think it's a small problem. I think it's a local problem. I think it's a community problem. So after I came back from Haiti, I lay awake thinking, how are we really going to deal with this? I thought, maybe, just maybe, we need to decentralize and democratize healthcare. I realized that if you were sick, the best place to create health might not be the doctor's office or the clinic, but your own community, with a little help from your friends. I realized that getting healthy is a team sport, that we're better together. And then one day, I was sitting in my office and I found Pastor Rick Warren from Saddleback Church in Southern California coming in and wanting to get religion about health. Now, after his appointment, we went to dinner, and over a bowl of beet and cabbage soup, I asked him to tell me about his church. And being a Jewish doctor from New York, I didn't really know much about evangelical Christian churches. So he told me he had this church, 30,000 people, 30,000 members. And every week they met in 5,000 small groups to study and support and grow together. I realized this wasn't a mega church. This was thousands of mini churches. And the light bulb went off in my head. I said, here's the chance to test out this idea of peer support for creating health. I said, Rick, why don't we put together a healthy living curriculum, and why don't we deliver it to these small groups in your church? And Rick said yes, because he'd recently baptized 800 church members, and after about the 501, he was like, wow, we're a fat church. He says, and I'm fat, and we need to do something about this. Now, we didn't need highly trained health experts except in designing the program. So a little more than a year ago, with Rick and Dr. Oz, my friend, and Dr. Hyman, a Christian, a Jewish, and a Muslim doctor, which sounds like the beginning of a bad joke, we launched the Daniel Plan, which is a social experiment to see if community support was more effective than medication or conventional medical care for treating and reversing diabetes and creating health. The Daniel Plan, which was named after Daniel the prophet from the Bible, who resisted the king's temptation of bad foods. It's a wellness program that's delivered through small groups in the church. Now, we thought a few hundred people would show up and sign up. In the first week, 15,000 people signed up. And over the last year, they've lost an estimated 250,000 pounds. Thousands of people from around the country, thousands of churches wanted to sign up all over the place. We had people from 189 countries wanting to get involved with the Daniel Plan. In fact, I recently met church leaders in Atlanta, and Bernice King, Martin Luther King's daughter. And she said she thinks health is a form of a basic human right that we have, that the disease is a form of injustice. She said that health is a form of nonviolence to yourself, and that she wanted to make this a part of the King Center's curriculum on nonviolence. And our social experiment worked. We got biology to change by using the principles of functional medicine, the science of systems medicine, of network medicine, of dealing with the causes of the causes, the science of creating health through lifestyle-based interventions that optimized our biological networks. But we got behavior to change by using the community and the power of positive peer pressure and social networks. Not only did they lose 250,000 pounds, but they used less medication. Many stayed out of the hospital. They didn't need to go to the doctor as much, and the program was free. And people reported more energy and better sleep and better blood pressure, better mood, even better skin and a better sex drive. One man told me last year he'd been in the hospital 4 times and was on 9 medications. This year he's only on 1 medication and has stayed completely out of the hospital. People lost 125 pounds, 90 pounds, 80 pounds. They got off insulin, they got off their diabetes and blood pressure medication. It was like a gastric bypass without a pain of surgery, vomiting, and malnutrition. And those who did the plan together lost twice as much weight as those who did it alone. E.O. Wilson, in his book, The Social Conquest of the Earth, says that it is our drive to join a group that makes us human. It's the longing to belong. And the power of positive peer pressure, the power of peer pressure can be a force for both good and evil. It can drive war and violence, but it can also be a force for healing. So here was the big insight for me. The community was not just a delivery system for health education. The community was part of the cure. The group
was the medicine. So what did we do? Well, we created this interactive curriculum. We delivered it through multiple media, online, education, videos, articles, recipes, webinars, events, all done in small groups and community events. We did this at Saddleback by changing the culture. Pastor Steve, who was born again, went from serving ribs and donuts for breakfast to being a health champion, grabbing donuts out of the mouths of the men in his small group. Over 1,000 people showed up and volunteered to be health champions for their groups. We changed what was served at Bible breakfast and the menus in the refinery, even what people served in their homes and their small groups. People learned to create health together, to shop, to cook, to eat, to exercise, and play together. We didn't treat disease. We didn't create a weight loss program. Disease went away as a side effect of creating health. We taught people self-care. And combining that with caring for each other, we created a small miracle. Something health care or health reform has not been able to achieve. So I think this is the seed of something bigger, a bigger possibility. In every home, in every community, in school and workplace, or faith-based organization, there are health champions out there waiting to be asked to show up and to help each other take back our health. We have a vision to scale this to 1 billion people. And we can turn healthcare upside down. We can democratize and decentralize healthcare. And this is not just possible in rich countries. Peers for Progress created pilot programs in the poorest countries in the world to treat diabetes in Cameroon, Uganda, Thailand, and South Africa based on peer support. The peer support group models were more effective than conventional medical care for improving the health of diabetics, and healthcare costs decreased by 10-fold. So after this meal of skinny Haitian chicken and this beet and cabbage soup, I thought, what if we could tackle this problem, not one by one in the doctor's office, but by the tens of millions in people's homes and churches and schools and workplaces? What if we could take the 36% of Americans who are out of work or eligible for work but not working and create a health corps like President Kennedy's Peace Corps, or a call to action that would be the equivalent of getting a man on the moon by the end of the decade? And create millions of community health workers, engage our world's latent health champions because they're out there in every community, in every organization of peers, of people helping people. People that with a little training has been proven to produce better results than doctors or our healthcare system for the worst problems of our era. Maybe, I thought, this isn't a medical problem like a broken bone or an infection. Maybe chronic diseases like diabetes and obesity are social diseases and need a social cure. Maybe it's the power of each one of us supporting each other that will help us all take back our health. Acute disease can be left to the hospitals, but creating health and healing chronic disease seems to happen best in the community with people helping people, where each one of us lives, where we eat and learn and work and play and pray. That's where health happens. When I was at Paul Farmer's clinic in the mountains in Haiti, there was a plaque in French that said, "The happiest man is the one who makes others happy." An old African proverb says that if you want to travel swiftly, travel alone. But if you want to travel far, travel together. So let's all do this together. Thank you.